Dr. Durst, and welcome to the podcast. And today we have a special podcast, and I have a guest with me, and we're going to start talking about some very exciting injury repair and how to make that happen faster. So I'm going to let Dr. Spencer introduce himself.
Hey guys, thanks for inviting me, Deborah. Appreciate it. Edwin Spencer, I'm an orthopedic surgeon specializing in shoulder and elbow surgery, and kind of got into the regenerative medicine thing, into the injury repair thing once I had my knee replaced, which was about 15 months ago. So that's how we got together. And I think my wife was coming here before that, and you'd mentioned something to her about that. And so that's when I came in and said, all right, Deb, tell me a little bit about what this regenerative thing is. What can you do to make me heal better, heal faster, heal quicker? How can I get my muscle recovery better? And so
Well, and I think since then it's been kind of a nonstop because, again, Dr. Spencer didn't mention it, but he is very, deep and focused into research, and so looking into things. And so if he can see that there might be other ways of addressing stuff, you're always looking into it and pushing us for even answers and how to do it. So I think that's huge, and that's one of the reasons why we're sitting down. So he has a great deal of knowledge, and again, he's one of the U.S. top elbow and shoulder surgeons. So I think that with all the injury that you see, you learned about this from a personal, perspective first. And so how do you think it changed how your surgery went when you had it?
Yeah, it's a little hard to tell because I've got an N of one, right? I've got one knee I've had replaced. My conversations with the surgeon who replaced my knee, the therapist, and just conversations with other people that have had total knee arthroplasties and kind of gauging, where they are, how long it took them to get there. I think I recovered more quickly, and I think that is in part due to the peptides. And certainly in part due to major part due to the surgeon that actually did the surgery. And I know my knee's not going to be perfect. I've had 4 previous surgeries on this thing. So when I had it replaced, I'm going for better. I'm not going for great. I'm going for better. And it is a lot better. And my strength really came back much more quickly than even my therapist thought that it would. And she was always pulling me back, and that's her job. And that's why I tell a lot of our therapists, that's your job with my patients too. Sometimes it's throttling them back a little bit because we know about the traditional biologic pathways of healing. And if we transition that to like a rotator cuff repair, which is what I do a lot of, and that's a lot of middle-aged folks, we have kind of a traditional timeline. But I just saw a lady today that she was on that TB 500 and she was playing tennis by 3.5, 4 months, which is atypical.
And she had a shoulder, was her shoulder?
Right. She had a rotator cuff repair.
Okay.
She had a rotator cuff repair. So I'm not saying that is always going to be possible. That's an outlier, and you never want to take one outlier and say, well, this is what we can expect here. That's not how you do things. But I think that we now need to start having more conversations about having a good diet beforehand, having a high protein diet afterwards, at least maximizing yourself from a hormonal standpoint to include vitamins like vitamin D, and then you can have further conversations. All right, once you have kind of the normal stuff that's maximized, how can we go above and beyond? I think that's where peptides kind of come in. But there's a lot that goes into diet even before and after.
Well, and I think peptides is just one aspect of it for sure. But I think as we started to look into this more, I learned a ton, even about the nutrition leading up to surgery. So in vitamin C, vitamin D, you're right, all the supplements you can do. Vitamin D technically still being, a prohormone, but
Right.
There's so much you can do and how important those levels are at the time of surgery. But I would love to, and that's what we plan to do a series on, just different topics. And again, if anyone has questions as we start to discuss, we're more than willing to deep dive into those and further podcast. But this started with your personal, you've had some patients. But again, have we, adding all the different adjuncts, is a relatively new approach, it seems, as I'm starting to learn more about it, because it's not something I recall learning much about, even as I was educating on regenerative stuff, how important, different nutrients are prior to. So what are your thoughts on, the different things that you would want to see a patient optimize for prior to a surgery?
Right. So I just had this conversation the other day with a patient, and the reason was, we've done some research together. You gave me some of the papers where you'd done research on PubMed, and one of the things I didn't even realize that carb loading before surgery. And I used to do triathlons, and a lot of athletes talk about carb loading beforehand. I had no idea that that would help with surgery and reduce how much muscle loss you're going to potentially have. But it makes sense. You've got three sources of fuel, right? You've got carbohydrates, fats, and proteins, right? So if you exhaust one of those or two of those, well, you're going to start eating into one of the other ones. And so if you've got a carb load and you've got a lot of glycogen stores, and the glycogen is that's the means by which we can package the glucose and have it accessible. It's in the liver, but most of it's in the skeletal muscle. You exhaust that. What do you go to eat next? Well, your body is going to take fats and protein, and gets its protein from the skeletal muscle. So within 48 hours, one of the studies you sent me, within 48 hours, there was demonstrable muscle loss after a total knee arthroplasty, and it's pretty significant after 5 days.
I was completely shocked by that information. It's not something I thought of before, but even carb loading up to the time of surgery, right?
Right. So carb loading up to the time of surgery, and then looking at the high protein diet afterwards and the amino supplementation, and showing that the amino supplementation reduced that muscle loss by 20% and increased your protein synthesis by 40%. That's huge. And that's just with amino supplementation. That's not with anything that's experimental, dangerous, anything like that. This is
nutrients.
Yeah, this is nutrients. You're just getting you're getting more macronutrients, and it just makes all the sense in the world. But you can do a lot yourself just by, I'm not saying that this is what everyone should do. This is what I do. What works for me is not going to work for you maybe, but I do a protein smoothie every morning. And so we've been doing that for years. But pure collagen, you can get it from bulk from so many different places. I do a plant-based one, but then I also do a bovine collagen one, and the plant-based one has probiotics in it. And those are things you can do just to promote health. And so I kind of see us doing some podcasts where we're talking about injury and injury recovery, surgery preparation, but then how do we maintain ourselves as we get into middle age? Because, like it or not, that's where we are. You can tell by my silver hair.
Well, I think that's one of the main things that brings us together is as we age, what I see every day is as we age, we're noticing changes, and healing and injury is one of those. Like, again, over and over again, every day you're seeing more injury, and you can probably talk to shoulder and elbow surgery and how that increases with age, or injury does, and how the repair takes longer after. I don't know if I'm sure that you can probably tell how somebody might do, based on status when you see them, and potentially also age.
Oh yeah, you can totally pick that up. Just visually, you're going to have an assessment. And you never want to, measure or judge a book by its cover. But there are certain things that you can kind of get a visual assessment of. This guy's, eating donuts and drinking beer every day, or this guy's actually working out and drinking smoothies and other stuff every day. So you can sort of pick up who's healthier and who's not. But there are some metrics, serologic metrics that we can use. Albumin is one of the proteins that we can measure in the blood. That has been shown in total knee arthroplasty. Those that have a lower albumin, they get higher infection rates and more complications. But then vitamin D is also, I think, just a measure of overall health. And that paper that you sent me was, I think it was like 50% of us, maybe more, 50 to 80% of Americans are deficient in vitamin D. I was when I came in, and I thought I was a pretty healthy guy. Come to find out, I needed some supplementation too, and various other things. And so you can do what you think are all the right things, like I said, the smoothies, but I still needed extra supplementation in other areas. It's hard to, I think, take in everything, all the macro and micronutrients that you need.
In a diet.
Right.
In diet alone.
Right.
Yeah. No, so I think that supplementing, well, that's one of the things that we'll talk about again, amino acids. Like, if you're doing that, you can take it in a diet. but you can do it in free amino acid supplementation, but you can also do it in injectables. That's another potential,
Right.
especially if they're not taking in much after. But no, I agree. I think that if we can hit some key points and things that people can do at home and know about, like vitamin D levels at the time of surgery and how important, something that I didn't know even when we started talking about this. But if you look at studies, and that's an easy thing that's measurable, that you can take it home and
Yeah.
prep for surgery.
And what was
And
one of the biggest things that we saw with COVID?
Oh, yeah.
Obesity and vitamin D levels. And so people were getting vitamin D in the hospitals. And so vitamin D is an immunomodulator. And so the vitamin D enzyme receptors are found on T cells and B cells. And so it's very important in the active and in the innate immune system. So there's that part of it too, preventing infection. And that's the low-hanging fruit. How do we prevent complications? Then there's the next level is how do we accelerate the healing process? How do we get better quicker? So those are two different avenues. One's the low-hanging fruit, the other's we're
progressing,
yeah,
getting a little progressive with it. So no, I agree. So how to prep for surgery, how to recover quicker, but also, maybe progressive, non-traditional ways of doing that as well as what they can do at home.
Yeah, and there's
prior
different
to.
exercises too. So there's the exercise nutrition part of it. So you kind of alluded to we're getting older and nothing really gets better except our wisdom, we think. Although
hope.
I kind of doubt myself there. But there's all the tendons and the bones are made out of collagen. And so we certainly need to take that more. We need to take that into account and have the macronutrients that help build the collagen. But then there's also muscle metabolism. How do we improve the tendon health? How do we not get rotator cuff tears? Because the science would tell us that when you're 60 or over, you got a 35% chance of having a rotator cuff tear. 70, it's 45%.
Those are the things that we all want to hear about, like the numbers, like again, how much it increases your risk of injury after a certain age.
So the same loads placed across a tendon, in this case, a tendon that's not as healthy is going to induce a tear. Are there better ways of doing exercises, lighter resistive exercises, different types of resistive exercises, maybe using a Tabata technique? Those are things that can really help, and how to do those exercises so that you can increase the blood flow of the tendon, have the tendon actually demand more, so there's more material in there to include the proteoglycans that make them stronger. So those are that's a whole nother avenue of how to maintain.
I like hearing all about, like things I didn't know. And what about even lubrication? I've heard a lot of patients come in and talk about like joints being more lubricated, or
Wasn't sure where you're
tendons
going with that, but yeah.
Yeah. Yeah. No, I was sticking with the ortho part.
Gotcha.
Yeah.
Good.
Yeah. But they talked about that, again, and I've not even heard about that, and how to keep tendons, ligaments, joints more lubricated. And I don't know if that's even exist, or if it does, if this is kind of what you're talking about, more exercise related, stretch related.
I'm talking about increasing the strength and the blood flow to the tendons. I'm talking about maintaining your muscle mass, because as we get older, we actually lose myofibrils. The sarcomeres stay about the same, but you lose the myofibrils in inside the sarcomeres. So how do we at least maintain the muscle mass that we currently have so we don't reduce that? How do we maintain our bone structure? Because every year after the age of 35 to 40, you're losing bone mass. How do we maintain that through diet, and how do we maintain that through exercise? And so there are various exercises. We'll point some of that stuff out.
Yeah,
in the
no, I
diet
think
too.
addressing all of those. So do you think that education traditionally, like when you were in orthopedics and you did you were at med school at Duke, graduated Duke, and then we're at University of Michigan. And I didn't really know that until recently, because I'm an Ohio State,
stuff,
and I'm a Buckeye. But I won't hold it against him. He didn't stay there, right?
Yeah, that was 5 years.
Do you think that we learn that in medicine, like how to maintain, how to exercise, because I can get to a lot of points that hormones play a role in a lot of that. But again, it's not something that we learned as far as traditional education, hormones, nutrition, fitness, and maintaining muscle mass,
Yeah.
bone structure as we age.
We didn't learn a lot of that because it was more geared towards finding pathology, determining if that pathology needs operative or non-operative treatment, and how to do that. So it was really problem-based. It wasn't preventative-based. Yeah, in medical school, you had to learn muscle physiology, bone physiology, tendon physiology, and stuff like that. But you learned it, and then at the end of the test, you sort of did one of these things, knocked all the information out. And now it's time for other stuff, right? So if you were really interested in it, if you're into it, you retained it. If there's a reason for you to retain it, then you would. So problem-based learning tends to cement things a little bit better. And when you're very interested, that's problem-based learning. So I think that there wasn't a lot, to answer your question, there wasn't a lot focused on preventative medicine.
And I think that's one of the reasons we're talking right now, because I think as you start to progress in a practice and you see different things, then that's how I ended up doing regenerative medicine, kind of anti-aging, is in hormone replacement, is that I didn't know it existed until I knew it existed. Right. And it wasn't a traditional pathway. But so when we talk about muscle retention, bone loss, as we age, and I think that's a lot of what we're talking about. Injury, where they're going to increase their percent of injuries. Like you said, rotator cuff, 35%?
Yeah, once you're over
after 60. Yeah. So I think most of that comes down to hormone decline, right?
A lot of it does. And then we could also address the acute injuries in young athletes, because we see a lot of those as well. How do we accelerate the recovery of those guys?
That's
getting
huge.
them back on the court, on the field, on the diamond, because it's super important for them. It's super important if they've got scholarships. And it's just athletics are a good part of living. If you, that has to be part of a normal regimen for you, is physical activity.
Correct. So I think that we're talking about, those perimenopause, menopause, andropause, like whatever it is, as we're aging, injury related, how to prevent and how to repair faster, but also how to repair faster and young and healthy and very athletic, which I think is huge right now, because we get lots of inquiries just about peptides related to that. Like, how can I get back to performing again, whatever it is that they're doing. Yeah.
And performing better. Yeah, but you're exactly right. We didn't get a lot of that in medical school. So now I think it's becoming more and more popular. People are talking about it on other podcasts and other media. In residency, we're just trying to learn how to operate and not to suck. What's your job today? Don't suck, don't screw this up. So
are you finding that the non-operative approach is becoming a more commonly utilized
there's
approach?
more biologics that are being used in non-operative approaches. So we're trying to leverage the body's ability to heal itself. Where do we find those cells that can heal themselves? The stem cells inside the bone marrow. How do we stimulate the current cells that are there using platelet-rich plasma, which is basically accelerating and putting a lot of growth factors, your own growth factors, fourfold the number of growth factors into an area where you want to create a healing response. And so those growth factors happen to reside in the platelets. And so we're doing a lot with biology, with leveraging the patient's own biology to heal them, young and old.
So, and I think we'll talk about that too. So we're going to do a whole series on different aspects of this. So, hormone optimization for those patients that are having issues with healing and increased injury as we age. Peptides to accelerate healing, again, vitamin D, vitamin C, albumin, and even supplements like creatine. So like in questions that you guys pose in comments, so please share anything you might want to hear about, because we're willing to deep dive into it. But also those regenerative procedures such as PRP, fat cell transfers, whatever else is out there, and even maybe some adjuncts to physical therapy. What else? Because there's lots of different nutrition. That's the big one.
Yeah, nutrition, and then I think various exercise programs and rehabilitative programs.
Yeah. No, so those are the things that we plan on discussing over a series of podcasts. So just let us know what you want to hear about. And otherwise, we're going to go ahead and dive into maybe each one as a separate focus. And if you have questions beforehand, that would be a good thing just to drop in the comments, share and with friends, and subscribe if you want to get notifications and you like the content that we're putting out. And otherwise, Dr. Spencer will be with us again, will be with me again, doing lots of different topics. And again, he is active, he's fit, he's a top surgeon, he's excellent at what he does. Great bedside manner. We've seen a ton of his patients.
Every single one of those words.
We've seen a ton of his patients, and they absolutely love him. So I think that we'll get a ton of information, and it'll help you guys know how to keep yourself healthy and prevent injury, and then also repair faster if you do get one. So anything else you would like to share before we wrap up this one?
No, I'm going to have to learn your background so I can.
I did look a little bit. So he actually graduated from North Carolina State University, then Duke Medical School, and then University of Michigan. And when I found that out, I was shocked. I mean, I like him so much. I can't believe that I didn't know that he was at University of Michigan for a while. So go Bucks. Yeah. And this last year was rough. The last 2 years were rough with that for the Buckeyes. So yeah, I must say. But anyhow, all right. Well, we will see you guys again. And thank you for listening.